Hello, we're going to present on social work for our IPE project. My name is Josh.
I'm Claire.
And I'm Jared.
And let's get started on this. So the required education for a social worker starts at a bachelor degree. A social worker will work to earn their bachelor's of social work, which provides a basic understanding of the social work field. This can include things such as developing skills in administering cases, organization, treatment plans, and response strategies. After they earn their bachelor's degree in social work, they can work to take their licensure exam, but most after that go on to earn a master's degree. A master's degree in social work aids students in expanding their basic skills and helping them to focus in on a specific area of social work, such as family work, youth, geriatrics, hospice, or mental health. Most clinical positions in social work require a master's degree. So moving on, I'm going to talk a little bit about the roles and responsibilities. As displayed by the figure on our presentation, there's a whole host of responsibilities that a social work can hold, but a few of the basic ones are recognizing and assessing the needs of clients. They can provide guidance to those in emergency or crisis situations. They can help to treat mental or behavioral issues. They refer patients to other medical professionals if it's necessary. And one of the biggest roles that they do have is being a caseworker that kind of manages and juggles all of the different things that people need to be eligible for things such as Medicaid and Social Security. Social workers can practice in a lot of different settings. So anywhere that people are helped, there are usually social workers around. That can include schools and jobs such as counselors or guidance counselors, mental health facilities and people such as counselors and therapists, nonprofits, hospitals, performing duties such as discharge planning and service coordination. They can work in law enforcement and prison with those who are incarcerated and who are transitioning out of incarceration. They can open a private practice if they have a licensed independent social worker licensure. They can work in government, working with policy or social issues at a national level, and they can also work in child welfare services as well.
So as Josh mentioned, the many different types of places that social workers can work in, they also help serve a variety of different types of populations that vary in age and characteristics. So one type of population that social workers often work with are children and students. So they would be working in a school environment, and social workers help promote the academic and social success of students or children in the school environment. And then another population that social workers commonly work with are the geriatric population. So social workers would be employed at a nursing home, and this is where they would help older patients kind of adjust to nursing home care. And then another large group that social workers work with are families, and whether this is a marital or spousal issue that affects the whole family and the family's coming in to receive help on how to deal with this, or it's like an ongoing problem for the entire family, social workers help deal with this conflict. And then other groups that social workers work with are patients with disabilities or patients with substance abuse issues, that's a large one, as well as veterans and people with mental illness.
So the relationships a social worker may be involved in vary depending on setting. A few examples would be a school. Social workers collaborate with teachers and school guidance counselors. They can also work in mental health facilities, and social workers work with psychologists and therapists. And they can also work in hospitals. They work with nurses and other clinical employees when helping patients. So our profession's connection to social work. So I'm in nursing. So nurses often provide critical information to social workers regarding the mental health status of their patient. For example, if a patient who was involved in a large accident that caused them to spend a large amount of time in the hospital was being discharged, may need to see a social worker to help them transition back into everyday life. With this being said, the nurse would provide the social worker with information regarding the patient.
As a exercise science major, I learned that social workers work hand in hand with people who are occupational therapists, which is a career that I would like to pursue. For example, if a patient has a steroid abuse issue, which is very common among people who are in exercise science and they deal with patients with this, then that patient may also see a social worker to help deal with the mental issues, as occupational therapists treat mental disabilities, developmental and physical issues, and a patient may receive treatment from both the social worker and occupational therapist.
And as a social worker, obviously there's going to be a pretty strong connection to the profession of social work for me.
So as for insights gained throughout this IPE presentation, like I said, I'm an exercise science major and I want to pursue occupational therapy. I learned that social workers work hand in hand with so many other types of doctors and medical professionals, and it's not just one doctor or one person treating a patient. It's like a whole team of patients that all work together that have a common goal, which is to help treat the patient. And previously to this presentation, I never really put the two together of how occupational therapists and social workers work together. But if a patient is seeing both of them, this may overall impact the treatment plan for the patient.
So as a nursing major, the insight I gained was that social workers don't necessarily have to work with children. They can work with older people in nursing homes and help people cope with transitions and healthcare-related issues. And they can also help with families with marital issues and other issues.
And being a social work major, throughout this experience, I learned the importance of interpersonal connection and relationship in the effective delivery of services to any type of patient that might come through. With my interaction with my group members, I've learned about the majors they represent and the professions they're going to pursue as well. Here's our references, and a special shout out to the wonderful Sheila Larkin providing us an informative interview.
Thank you.
Thank you.